Welcome, medicos. Let's begin with this quote: choose hope daily. Today's topic is cryptococcal meningitis. The objectives are introduction, pathogenesis, diagnosis, source of infection, mode of transmission, clinical manifestation, laboratory diagnosis, and treatment. In microbiology, the laboratory diagnosis part is the most important part, and in all of the questions, it is mandatory to be written. Let's take a question to understand what type of question can come in university examination. Describe the pathogenesis and laboratory diagnosis of cryptococcal meningitis. Mention the laboratory diagnosis of cryptococcal meningitis. Describe the laboratory diagnosis and treatment of cryptococcal meningitis. So in any way, you can see laboratory diagnosis is the most important part. In all the questions, laboratory diagnosis is there. Let's begin with the introduction. Cryptococcal meningitis is caused by Cryptococcal neoformans, which is a capsulated yeast. This is an opportunistic infection, and we have two species of Cryptococcal neoformans. And in that two species, we are having four serotypes. So first species is Cryptococcus neoformans, and the other one is Cryptococcus gattai. Cryptococcus neoformans has A and D serotype, and Cryptococcus gattai has B and C serotype. So total four serotypes: A, B, C, and D. The A serotype is known as Cryptococcus neoformans variety grubai, and the D is known as Cryptococcus neoformans variety neoformans. Let's talk about the pathogenesis. So this spreads through inhalation of aerosolized form of Cryptococcus. It enters the lung, then it causes pulmonary infection, then dissemination through blood occurs, and then CNS spread can happen. There is a unique property shown by Cryptococcus, as it has the ability to cross the blood-brain barrier. It crosses the blood-brain barrier by two means: either the yeast cell migrates directly across the endothelium, or it is carried inside the macrophages as Trojan horse. This Trojan horse is the wooden horse that the Greek hid to enter the city of Troy and take it over. So there is a story in which we read that the wooden horse was used by the Greeks, and the soldiers hid inside that, and by this way they enter the city of Troy. The virulence factor of Cryptococcus that favors invasion and spread of infection are: the most important one, polysaccharide capsule. It is the principal virulence factor. It has anti-phagocytic property. It also inhibits the host local immune responses. Then the ability to produce phenyl oxidase, which makes melanin, and the production of phospholipase and urease. So these are the virulence factor of Cryptococcus. Risk factors are: patient with advanced HIV infection with CD4 T cell count less than 200 microliter. They are at high risk of acquiring C. neoformans infection. However, the C. gattai is not associated with HIV infection. It usually causes infection in immunocompetent individuals. The other risk factors are: patient with hematologic malignancies, patient on immunosuppressive or steroid therapy, and transplant recipients. Clinical manifestation of cryptococcosis are: pulmonary cryptococcosis. This is the first and most common presentation. Then we have today's topic, cryptococcal meningitis, which presents as chronic meningitis with headache, fever, sensory and memory loss, cranial nerve paresis, and loss of vision due to optic nerve involvement. We also have skin lesions commonly seen with Cryptococcus neoformans variety neoformans serotype D, and then we have osteolytic bone lesions. Coming to the most important part, laboratory diagnosis. For writing laboratory diagnosis, we must know what are the specimen to be collected and then the methods. So the specimen here we will be collecting CSF. In other cases, we also collect blood and skin scraping for cryptococcosis, but for cryptococcal meningitis, the most important specimen is CSF. So we have direct detection methods like negative staining, gram staining, other stains like mucicarmine stain, Masson-Fontana stain, LCN blue stain, and then we have antigen detection. Also, we do culture CSF. The direct detection method, we talked negative staining. In this, we use modified India ink stain, which is added with 2% mercurochrome and nigrosin stain. This helps us to demonstrate the capsule, which appears as refractile, delineated clear space surrounding the round budding yeast cells against dark background. So this is the diagram. This is the yeast cell, and this part is the capsule. You can see the thick capsule here. This thick capsule is responsible for having mucoid appearance in the culture also, which we will be talking later. In gram stain, we see gram-positive round budding yeast cells. In gram stain also, we can visualize the capsule sometimes. Other stains include mucicarmine stain. This stains the carminophilic cell wall of the Cryptococcus neoformans. Mason-Fontana stain, which demonstrates the production of melanin. Then we have Alcyon blue stain, which demonstrates the capsules. Then we have antigen detection. The capsular antigens can be detected from CSF sample or the serum sample by latex agglutination test. The advantages are it is a rapid test, the sensitivity is very high, 95% sensitivity, and it is a specific method. To talk about the culture methods, the CSF sample is inoculated into SDA without antibiotics, blood agar, and chocolate agar. And then it will be incubated at 37 degrees Celsius. If the sample is a blood sample, then it is inoculated in biphasic blood culture bottles. In SDA, we see that the colonies appear as mucoid creamy white and yeast-like, as you can see in this diagram. As I have told earlier, this mucoid and creamy appearance is due to the presence of capsule on Cryptococcus. So how do we confirm a cryptococcal species? We have Niger seed agar and bird seed agar. They are used to demonstrate the melanin production. Brown colored colonies will be formed. Then we check for their growth at 37 degrees Celsius. We read that the production of phospholipase and urease are the virulence factor for Cryptococcus. Hence, if urease test is positive, then we can confirm that it is a Cryptococcus species. Then we have assimilation of inositol and nitrate. We check for mouse pathogenicity test, and automated identification systems such as Malditov can also be used. To talk about the treatment depends upon the type of cryptococcosis. If cryptococcosis is without CNS involvement, then fluconazole is the drug of choice. And if HIV infected patient is there with CNS involvement, then we have this recommended regime. In induction phase, for the first 2 weeks, we give amphotericin B plus minus flucytosine, which is followed by oral fluconazole therapy till the CD4 T cell count raises greater than 200 microliter for 6 months. This means that for 6 months, the CD4 T cell level should be more than 200 per microliter. Till then, we will be continuing oral fluconazole therapy, and this will be stopped. Thank you. We'll get back to you soon. Keep smiling.